Good afternoon, everybody. Where I come from in South Africa, you would always accompany a greeting with asking people how they are. So I'm going to ask you, how are you as well? And hopefully, given that it's this late session in the day, we're all still feeling relatively alert, especially after all the amazing food. But I am the program leader, as has already been mentioned, of an innovation for early childhood development in South Africa. And I'm going to just talk to some elements of that innovation that really relate to the funding elements of it and what we are trying to do around specifically influencing public policy for finance and also budgeting processes and trying to bring higher levels of resourcing to early childhood development in the country. So I'm going to just start off just by talking very briefly about two elements of the program itself. The one is that we are engaged very specifically in pushing an agenda for an early, an essential package of services for children. I mean, we've heard lots of talk here today already around the issues of integrated service provision and so on. And really that's looking at the development continuum from conception through to the entry into formal education and looking at the cross-sector of services that young children need to have access to and their primary caregivers need to give them the best start and the best chance in life. So that's really the basis of the intervention. The second thing is that within the South African context, funding for early childhood development in its current form doesn't provide a solid base for universal access. That it tends to still be advantaging the advantaged and children who really do need access to services. The way that the funding models are currently structured are not necessarily facilitating that level of access. So it's into that space that Ilifa has been working. So the first thing to say is that Ilifa is a donor collaboration. Essentially, 3 donors in South Africa came together, all of them with a great interest in making a difference to early childhood development, and particularly to focus on the 40% of poverty-affected children growing up in South Africa. So it had a very specific focus and a very specific interest in those children who were most deeply affected by poverty in the population. These 3 donors are one is a large South African donor called the D.G. Murray Trust. The other is Elmer Philanthropies, who you might know. And the third is a national bank, First National Bank. And then we did also at one stage have UBS Optimus also as one of the key partners. They've stepped back a little, but they remain engaged in the program and are one of the founding partners. So these 3 partners really got together and developed together a strategy for early childhood development. And this donor platform essentially leads and pushes this strategy. So Ilifa is an actor in the sector, using its resources really to bring change, and those resources are used catalytically. So we look for partnerships both in civil society and in government. The idea of crafting government systems was talked about in the session earlier. At the core of the focus of Ilifa is that government is the primary duty bearer for the provision of early childhood services, and that may be done in various forms of partnership with various players in the sector, but primarily it holds that responsibility. So one of our first things to do is actually to engage directly with government. We are working in modelling and testing situations in 2 provinces in the country, and those modelling and testing situations are governed by memorandums of understanding between ourselves and government. We then work around those memorandums of understanding and we bring other partners into this process who then are able to actually act as the service providers. So for example, through the funding we would bring a home visiting program into that province. It would be implemented, but it would be implemented in partnership with government. And really our focus is on enabling the system. How do we institutionalize programs like this so that we can talk directly to the issues of scale? So really the resource base of the program is about creating access and leverage. Okay. We have together one fund. We are working on one focus. And in South Africa at the moment, we see a huge interest politically in early childhood development. So we know that we are working in a space where we have a window of opportunity. Within this donor fund, there are certain elements. I'm sure those of you who work with donors or who come from the donor community know that it's often governed by lots of issues and challenges around how we're monitoring, how we're evaluating, and all of the issues that go with that. And so getting this donor fund actually to run and to work effectively has been in itself a fairly ambitious initiative. But given that all of them have had this deep commitment to early childhood development, we've managed to make it work. And the idea really is that the fund is able to move quickly. So instead of us thinking months and having to prepare reports and get things going, we're able to move the resources relatively quickly once we've identified exactly where there is an area of intervention and once we have a strategic partnership on the ground. Now, see, I have 1 minute, so I have to move very, very quickly through this. Because I want to just get to some of the interesting things around this. What the partnership has ended up being is quite generative, okay? And it's generative in a few ways. The one is that these donor partners have come together. They have all put an additional, fairly large sum of money into a pot to make this strategy work and to drive this strategy. They continue to each hold their individual ECD portfolios and continue to fund early childhood development in other areas in the country. So bringing together, in other words, a doubling of funding through these organizations to the sector. Then the other thing that we are engaged in through the way in which we use the resources that are sitting in the Ilifa pot is, I'm rushing and I want to get to this because I think this is where it is interesting to the conversations that are happening here, is to increase the flow of funding, and the other is through government buy-in to actually increase what government is contributing to early childhood development. So I'll just give you an example of this. In one of the provinces where we are implementing, we have done very specific costing work on what the service provision actually costs. So taking a home visiting program through home visitors at community level to be supporting vulnerable families costs us X amount to get that program going. To run early learning playgroups has cost us X amount. We then use that in our partnership with the Department of Social Development and the Finance Directorate of that department to together prepare the budget bid, which then goes to Treasury. And through that process, we have brought for the first time into that province funding to community-based early childhood development. The challenge around this is that the department itself doesn't have the institutional pathway at this point to be able to use that fund effectively. So in other words, it doesn't have a way of contracting these workers directly to then implement the program. So at the same time as us working with the funding, we work with the system around what are the system changes that need to happen to enable this program to be taken up, to enable the employment of these workers, and then at the same time to be able to use this funding to contract them in the right way. So it's a bit of a top and tail kind of approach all the time with our eye on the system, but at the same time pushing the system to change through the implementation on the ground. There are a couple of other examples like that of impact on this work, and I unfortunately don't have enough time to share all of those with you. But there are a number of our publications that are in, that were sent to you. And perhaps I could just say one last one very quickly, is around working directly with Treasury in South Africa. One of the other successes of this program so far has been that funding to children in centres in South Africa comes via a per child per day subsidy. Not every child is able to access that subsidy because there isn't enough for it to go around for every single child. But in order to access that subsidy, centres have to register. At the moment, that registration process is particularly onerous. There are 3 levels of registration involving 16 different stages. A study that's included in your pack that we did around this was taken on board by National Treasury in South Africa. We were asked to come into conversation with them to talk about how we could enhance the system to begin to overcome some of these barriers to accessing registration and therefore accessing the per child per day subsidies. We're currently involved with them on looking at how to refine the system. The processes have now led to bringing together all of the directors of finance from all of the departments of social development to start talking about how to refine this. So these are just some of the ways in which we've used the resourcing that we have at our disposal to demonstrate and model work around what is possible, and at the same time to use that modelling and testing catalytically to really drive for an increase in funding and resourcing to ECD. Thank you very much.